Hey everyone, Dr. J. Bowen here. Welcome back to the Jersey Regenerative channel. Over the last few weeks, my team and I have been shedding some light on various regenerative treatment procedures. Last week, I did a video on the definition of stem cells, along with their history and what the FDA approval for stem cell looks like. Today, in part 2, I wanted to share my own opinions on stem cells, as well as answer some of your questions. If you've been enjoying this series so far, be sure to like and subscribe, and hit that bell notification so you know whenever there's new videos dropped. So this is going to be another great video, so let's get it rolling. Let's get started with the positives. I'm genuinely excited about the potential of stem cells and what they can mean for the future of medicine. So why all the excitement? Well, stem cells have a remarkable ability to differentiate into a variety of cells, such as muscle, cartilage, nerve, you name it. This versatility opens up a door to countless possibilities for repairing damaged tissue, promoting healing, and even potentially reversing the effects of aging and chronic injuries or disease. But it's important to note that stem cells don't work exactly the way most people imagine them. Dr. Arnold Kaplan, a leading figure in stem cell research, was the one who originally coined the term mesenchymal stem cells, or MSCs. However, as science evolved, he recognized that he didn't fully capture what these cells actually do in the body. Rather than directly turning into these new tissue types, MSCs primarily act by sending out signals to the surrounding cells and tissues. These signals help to reduce inflammation or modulate it, stimulate tissue repair, and create an environment that promotes healing. Because of this, Dr. Kaplan suggested renaming them medicinal signaling cells to reflect their true role. So while the idea of stem cells morphing into any cell type is exciting, their real power lies in their ability to direct and support the body's natural healing processes. Stem cells have shown a lot of promise in treating conditions like arthritis, tendon injuries, or even heart disease. Clinical studies are exploring their potential in neurologic disorders like Parkinson's and spinal cord injuries too. These are groundbreaking developments that could change how we approach medicine entirely. Another huge plus, stem cells are generally minimally invasive treatments. They can be harvested from the patient's own body, usually from fat or bone marrow, and then reintroduced into areas that need the healing. This reduces the risk of rejection, since the body is less likely to react to its own cells. The good news also is that many orthopedic issues can be treated even without stem cells, and even other less costly regenerative treatments such as PRP, BMAC, or MFAT. If you want to know more about these treatments, you can watch my other videos here on YouTube. Just take a look and we'll link them. I've had quite a few patients who tried stem cell treatments and experienced incredible results, with less pain, better function, and improved quality of life. But here's the problem. Many people visit bad clinics and are told they're getting stem cell therapy, when in reality, they aren't receiving any actual stem cells. It's crucial to ask the right questions and get all the details before undergoing a procedure. Unfortunately, this kind of misinformation gives the field a bad reputation. But when stem cells are done right, the results can be life-changing. One of our Instagram followers, @WhiteCoatFit, asked, "Do you do stem cell treatments at NGRI?" The short answer is yes. But we really don't do it that often. Why, you might ask? Well, because it's a complex and expensive process that most people actually don't even need. Many of the issues can be treated with alternatives like PRP, BMAC, or MFAT. So click here to watch the videos on these treatments as I noted before, and it'll give you much more information. These are powerful options that help harness your body's natural ability to heal without going straight to stem cells. Now, if we're already performing a fat aspiration for an MFAT treatment, we can take additional fat to grow and store your stem cells for future use. This way, if you ever need them, they're ready to go, and you can avoid another fat draw. I know some people are eager to lose fat the easy way, but that's a whole different topic. And no one's ever complained to me that I've taken too much fat. Actually, they ask, can you do a little bit more? The downside is, though, it takes around 2 months to process these cells and have them ready. So even if you need to be treated today, you gotta wait 2 months. So if they're stored there for you, if you have a future problem, they're ready to go quick. It's also important to know that there's no FDA-approved way to use your stem cells for orthopedic issues right now. So the cells may sit in our lab, and you can never use them or get a chance to legally use them. However, thanks to the Right to Try Act, signed in 2017, we can use your stem cells if the process is done correctly. So while it's not common that we use stem cell therapy, it's still an option that we have in our back pocket to offer if it's really the best solution for the patient. Next week I'll be doing a video with the Right to Try Act, so you know what to do. If you don't want to miss anything, hit that like button, doesn't cost you anything, subscribe, and hit the bell notification. That way you won't miss anything. Now, for a deep dive into the not so good. While stem cells offer a lot of potential, they're not a guaranteed solution for everyone. The biggest challenge is that the results can be inconsistent. Some patients experience significant improvement, while others see little to no benefit. So why the big difference? Well, we're still trying to figure that out. And as with other treatments such as PRP, BMAC, MFAT, and other novel treatments, Data Biologics' collection of these results will help us direct your personalized medicine in the future. Another issue is that stem cells, while minimally invasive, still carry some risks. There can be complications like infection, nerve damage, or bleeding at the injection site, especially if the procedure is performed by inexperienced hands. Most of the really bad outcomes were due to the inappropriate performance of the procedure by individuals who shouldn't have been performing it in the first place. A stem cell treatment or regenerative treatment should be an extension of a physician's practice who understands and manages all aspects of that disease, with it being just another option when simpler, cheaper, and less risky treatments have failed. However, there are rare reports of abnormal tissue growth after stem cell treatments, but these are related to a variety of factors that in safe clinics are well controlled. In one case, a patient had abnormal tissue growth after traveling most likely to multiple countries, having multiple procedures with different types of cell processing and potentially cell types, and maybe without even telling the providers their entire history or that they received any of these prior treatments. Obviously, this was a recipe for disaster. Then there's the question of cost. Stem cell therapy can be expensive, and many insurance companies don't cover these treatments because they're still considered experimental for orthopedic issues. This puts us out of reach for many people who potentially could benefit. If you're concerned about cost, give my office a call so we can discuss pricing options for you. One of my goals is to keep all of my treatments affordable. So what's the real truth about stem cells? Well, it's complicated. The truth is, stem cells are an exciting and burgeoning field of medicine, but we're still learning a lot about how best to use them. While early results are promising, more research is needed to truly understand who benefits most, what conditions they work for, and what the long-term effects might be. Not all stem cell treatments are created equal either. There are different types of stem cells, like embryonic, adult, and induced pluripotent cells. And they each have their own pros and cons. Here at NJRI, we focus on adult stem cells derived from your own fat because they have a safer and more established track record. You also need to be cautious about where you go for your stem cell treatments. Unfortunately, the hype around stem cells have led clinics popping up everywhere that offer unproven, unregulated therapies and may not even be stem cells. Some of these places make bold claims and just don't have the science to back them up. So if you're considering stem cell therapy, make sure you're working with a reputable clinic that's grounded in research and ethics, like my team here at New Jersey Regenerative Institute. At the end of the day, stem cells aren't magic, but they are a powerful tool in our regenerative medicine toolkit. And with the right patient, the right condition, and the right approach, stem cells can make a big difference. One of our followers asked where I see stem cells or regenerative medicine being 10 years from now. And that depends on a lot of factors, with most being governmental regulations, roadblocks, cost, and the data we get. Stem cell technology is labeled as disruptive technology, and the establishment doesn't like change. If we truly want to advance this treatment and field, we need partners that demand collecting data in the right way to support personalized and precision medicine, not just talk. Insurance companies manage risk, and if we can demonstrate that a regenerative treatment will reduce costs for them, they'll likely pay for it and cover it. While we wait for stem cells and other regenerative techniques to be approved, please remember your health starts with your beliefs and your actions. So start today. Get clean air, clean water, movement and exercise, manage stress, get a good night's sleep, and nutrient-dense, unprocessed foods without herbicides and pesticides. It sounds easy, but the basics are not emphasized in our U.S. healthcare system, and it's hard in the current times. Take one step at a time toward unleashing your body's intrinsic ability to heal itself. So there you have it, the good, the bad, and the truth about stem cells. I hope this helped clear up some of the mystery and gave you a better idea whether stem cells might be a good option for you. If you left us any questions across their socials, my hope is that we'll be able to answer it for you. If you still have any questions, leave them down in the comments below, or feel free to give our office a call. This week, we'll be releasing the dates for our upcoming YouTube Live with Data Biologics and CEO Leah Bradell. So, if you don't follow us already, make sure to connect with us on TikTok, X, Instagram, and Facebook. If you found this video helpful, make sure to hit that like button, subscribe, and hit the bell notification so you don't miss any of our content. Thanks for watching, and I'll see you next time.